One thing I think that makes Loma Linda unique, one of the reasons why I chose to come here was because of this environment. There's this kind of spirit of encouragement, of supportiveness.
I was the very first resident. I was going to be drafted and sent to Vietnam after internship. Dr. Varner Johns, he had a friend on the draft board and got a special exemption for me to come and be one of the first two residents. Dr. John Sprode also came with us, and we had one intern, John Hodgkin. And we started in with just two residents, one intern, and about 20 attending.
I was here from 1980 to 1983. My memories here are remarkable. Probably one of the ones that I valued the most during my time here was that my training wasn't at just one place. I got to be one of the inaugural classes at the Veterans Hospital, got to be one of the later classes at Riverside General Hospital, and then had opportunities to work here at the medical center. And each of those experiences added something valuable to my education.
We get to rotate through the university, through the VA, and through the county hospital.
Those three different venues give the residents a very unique experience. And on top of that, we have an emphasis on whole person care.
Whole person care is the reason I came to Loma Linda. It was what I think, to me, I had hoped would set apart my training. What I've come to understand whole person care to be for me is being sensitive to listening to the Lord's voice as I'm listening to patients, which is listening to what God is doing in that person's life as they tell me their story. It might mean bringing up spiritual conversations. It might just be lending a hand and a heart to really listen to where they're at.
If you're going to take care of a patient in the long term, it's best if you can learn how to care for not just the pills and the medications, but the rest of their also mental, physical, and spiritual well-being.
I think it's important to learn it in residency so that you have a good foundation. So when you leave and go practice on your own, you don't forget that, a person is not a number or a statistic.
When you care about whole people, it's not just the patients. The residents care about each other, the residents care about the attendees care about the residents. So it makes it a more personable residency.
I've been to Harvard, I've been at the Mayo Clinic, I went to Stanford, I've been to many medical centers. And I never really saw the collegiality and the professionalism that I have witnessed here at Loma Linda University.
I came through the program as a student, as a resident, and now as a faculty member. One of the reasons why I decided to stay here to be a faculty member and to work is the fact that if I had a question in the middle of the day that maybe required a specialist input, I wouldn't have to wait for a consult that would take forever to get done. I could just get on the phone, call a colleague and say, hey, what do you think about this case? And get a response right away.
I felt as a resident coming through, and now as a teaching faculty, I feel that we really give residents good exposure to the different facets of medicine, and I feel like our graduates leave our program really solidly trained.
So they see a very wide variety or range of patients, and I think that gives them a very, very good clinical background in their training.
Our residents are competitive with any California school in terms of passing the national board exam. We have a research track. We have faculty who are devoted to teaching and patient management. There's all kinds of reasons why this is an excellent place for an internal medicine residency.
I've never met so many people who just want to teach. Also, the opportunity for learning is vast.
Our program really looks to create each person in their own unique journey.
One of the things I really appreciate about our internal medicine program is that we are allowed to do these international electives.
We're connected with Adventist Health International, which allows the residents to choose from over 20 hospitals of international elective sites.
At the end of my third year, I went to Malamulo Hospital in Malawi, and it was an experience where, like never before, I felt like I was actually able to make an impact.
It's such a powerful impact on their lives, the different things that they see, the spiritual growth, the personal growth that they have, and not every internal medicine program offers that.
You know, I could let you walk down this hallway into the Baylink laboratories, see the work that's being done in regenerative medicine, and the excitement that some of our students are having as they're introduced and our residents to cutting-edge research, some of the publications they're getting to be a part of.
I think my whole career I've always wanted to have a positive impact on people. And, you know, as a physician, you can do that to the community you work within and the colleagues you work with. But when you're in charge of a training program, your efforts are multiplied and propagated to the future.
What I suspect is in our future is that more and more the barriers that separate the hospital from the community are going to need to come down.
We're going to maintain the traditions that we've kept for many years, but bring it to the sort of 21st century.